Hello, I am Melvin Leitner, pronouns he, him, his. I am the prevention specialist here at Equitas Health. I also facilitate the empowerment group called BroCode, which can be found on Equitas Health website. And I am your host today. We welcome you to the BroCode Ohio podcast. This is a platform where we are here to empower, educate, and build participation in community amongst people at risk of contracting HIV and also living with HIV, including youth and adults regardless of age, race, gender, or sexual orientation. The reason why we are here today is to honor National Black HIV/AIDS Awareness Day, which is celebrated every February 7th. It is to uplift communities, encourage people to take responsibility of their health, and to simply bring about awareness, get tested, and to combat against the HIV stigma in our community. Today, we have a special guest with us, Shelly Turner. She is the Prevention Health Navigator here in Northeast Ohio, the facilitator of Sassy Paw Sisters, a mother, a grandmother, and also someone who is striving and thriving with HIV for 25 years. She's also my friend, my coworker, my homegirl, and I absolutely love her. Thank you for being with us today, Shelly.
Thank you.
So this is our first podcast, and I'm so excited, and I thank you all for viewing us and watching us. So we're going to get started with this conversation on HIV in the Black community, stigma, some of the things that we experience being in this position, and being in the community where we're seeing situations hand on. We're the frontline workers, right? And so one of the things I wanted to talk about, give information on, is the statistics that are in the African American community. So we have been fighting this fight for over 40 years. We have seen changes from HIV leading to AIDS, being a death sentence, to now people who are just thriving, living longer and healthier lives. The HIV epidemic has impacted the world entirely. This goes to a point where there are 897 new diagnosis of HIV cases found in Ohio in 2020. 82% were amongst males, 52 were amongst African Americans. This is 8 times higher among white people. And then more than half diagnosis between the ages of 20 and 34 years. 54% of this was male-to-male sexual contact. 69% were heterosexual contact transmission, categories being females. 86% are heterosexual Black women. There are also 96 people living with HIV as of December 31st, 2020. That is slightly more than half of people that are living with HIV only, meaning they have not progressed to AIDS, and slightly fewer than half already progressed to AIDS. White people and Black African American people each slightly make up more than 40% of persons living with HIV. The rate for African Americans was more than 6 times higher than whites. And that's why we're sitting here today, because that's the issue, and we're trying to combat against the reason why that is and to talk about it. So for the first question that I would like to ask you, Shelly, with the statistics presented to us, what do you think personally of why the African community is disproportionately affected by this?
First off, thank you for having me be here. I think it's very important. One, it's alarming to see those numbers, especially in the Black community. Especially being a Black heterosexual woman is alarming. I think that one of the reasons why it's so high is the lack of education, the lack of information and education in the community about HIV. Being, how we're out and about in the community, a lot of people are like, oh, I thought that was gone. I thought HIV is still around. Yes, HIV is still around and it's strong. And when I first started in Prevention Health Navigator, it was in 2019, it was 86% of African American heterosexual women had the possibility to get HIV. That is alarming.
Yeah.
That's alarming because we had to find out why this is happening. It's 2020, 23, the 20th century, and people are still not contracting. So I think it's a lot of lack of education, lack of wanting to know, thinking that, it's gone, and then women just not asking the right questions.
Yes, that rings a point. And stigma, along with that, and the medical mistrust, people stigmatizing. People are afraid. People living with HIV stigmatize themselves.
Mm-hmm.
People that aren't living with HIV stigmatize it. And I think it's important for us to start looking at that and being aware and being cautious of how we're stigmatizing and why we're stigmatizing.
Well, I think that, sorry, I didn't cut you off.
Go ahead.
I think that when I first got diagnosed 25 years ago, it was stigma heavily because they weren't diagnosing women. We were very rare. And so we kind of like, well, not everybody's, only men are, what the heck? So we had to kind of seclude ourselves. So it was stigma. We didn't want anybody else to know. But now in 2020, 2023, now it's more stigma within ourselves, because when I tell people that I've known for 25, 30 years, oh, by the way, I'm HIV positive and I've been HIV positive for 25 years. They're looking at me like, Shelly, why didn't you tell us, number one? And then so what? It's not such a big deal. I made it a big deal instead of, thinking about their reaction was going to be horrible. And I was trying to save myself from that, but it wasn't. It was just like, okay, that was it.
You mentioned that you've been living with HIV for 25 years. In that moment, you found out that you were positive. What was it like? Now, how did you deal with it?
When I found out, I was pregnant with my last daughter, and what had happened was I heard through the grapevine that this guy was positive, HIV positive. So I went to the doctors, I took the test, it came back negative. It was a horrible 2 weeks, because back then you had to wait 2 weeks, not like us now, where we get tests like instantly. We had to wait 2 weeks before our test results came back. So I'm like terrified for the first 2 weeks, and then I got the test result back, it came up negative. But he's like, oh, it says come back in 6 months because, you're pregnant. Just come back in 6 months. Don't worry about it. So the whole time I didn't worry about it. It was in October, because I had my daughter in March, and I came back in October and waited the 2 weeks again. But I didn't think about it. That one's going to come out negative. The first one came out. So he calls me in, and he didn't call me in last time. I'm like, well, there's something going on. So he calls me in, and he stood there, and I was in the room by myself for a minute, pacing back and forth. I'm like, this can't be good. It's like, literally, he told me he was outside the door trying to how to tell me that I was HIV positive. So he came in with some technical doctor excuse. Well, you have an antigen that causes HIV, and I'm gonna need you to call this doctor to get more information, but also get your affairs in order, because HIV is deadly. It's automatically you're dying in 5 years. So I was like, oh my God. I literally was a blank. I drove to my best friend girlfriend's house, and as soon as she opened the door, she seen my face, and she was like, what's wrong? And that's the first person I told. My daughters were at daycare, so they were fine, but I just told her that, and that was the first person I told, and then I didn't tell anybody for like 2 years after that. And then my family, then they got out that my family knew, so they were very supportive. Thank God, because a lot of people aren't blessed to have that. I have a huge family, and they were very supportive. So I've actually never had a negative reaction from it. It was just more stigma, internal stigma for me, because I was like, oh my God, if somebody finds out, this is going to happen. But it also made you feel like you were dirty, because it had that stigma, oh, you're dirty, or don't do this and don't do that. And I was petrified because my period would come, and I was just horrified to where to put my pads at. And it was terrible. I didn't want my daughters to touch anything. If I cut myself cutting, I wouldn't cook for like 2 weeks. It was just that mental internal stigma.
Yeah.
And it's a life-changing experience. So when I test somebody now, I tell them it's not a death sentence, but it is a life-changing experience. There are some things in your life that you're going to have to change, and some people can't accept that.
Yeah. Thank you for sharing that. You didn't have to, but thank you for sharing that. Thank you. There's some tissue here. Thank you for the transparency. Because I definitely can attest to that and experience. And I experienced that too. I was blank in the moment when I found out. It's been 5 years, and when I found out, I was blank. Wasn't mad at the world. I was mad at myself because of my choices. I have to stand in accountability. So I put myself there.
Mm-hmm.
This is where I'm at. It was because of my choices, and my behaviors, and my risks. So I thank you for sharing it.
I had 3 girls to raise.
Yeah, just like I have all these other issues.
Yeah.
This is one thing that I think that's a lot with people in general, but even with Black women specifically, they're strong.
Yes.
Black women are strong, and they take on this responsibility. They're mothers. And they know how to put the mask on. Like, they could be crying around the corner over here, hurting, but can come around the corner with a big smile and love and embrace you. So, I honor Black people. I
appreciate that.
Yes,
because
for their courageousness and their bravery.
It's a double-edged sword sometimes.
Yeah,
it is. So it's truly a double-edged sword sometimes, because we want to be, we are. It's just women in general are strong women, because I work with a lot of women and they're strong, but Black women is just there's just something about us. And it's not that we always want to be strong. There's some times that I will break that, and people are like, oh, Shelly broke that. It happens. It happens. I got a good support staff that support people in my life that allow me to do that.
Yeah. And I think it comes to that point of being newly diagnosed. I know this was your question, but being newly diagnosed and coming to in terms of accepting that, and it takes steps. That's why it's important to get into social groups and to get therapy and to make your doctor's appointments and get into care and treatment. Because as soon as you eradicate the HIV in your body, you get to levels of looking brilliant and beautiful like we are today.
Yes.
And like you are today. You live a healthy and a normal life. It's a chronic disease like any other disease out here. It is a chronic disease.
Well, I commend you young people, the newly diagnosed, not even just the younger generation. You guys, when you guys get diagnosed, you accept it more faster than ones that are older diagnosed. There's some people that I come across that have been diagnosed for 30 years and they're just accepting it now. They're just comfortable enough to come out and say, I'm HIV positive. 30 years, that's a long time to live in the shadows.
Yeah.
To live in the dark. That's a long time to have that on your chest, on your heart, that's a lot of stress, and I don't want anybody who's newly diagnosed to feel that way again.
Yeah.
So that's why our support groups are so important, because that way, if somebody is diagnosed, have them talk to somebody. You that peer navigating is so important, because they feel like there's sometimes that they're the only ones. They're the only ones have it. I don't know why, but they feel like anybody, like somebody who has cancer. I'm the only one going through this and stuff. No, you're not. That's why they get in support groups fast. That support group is a very important to know that you have your peers that you could talk openly about your status. That is so important. So important.
Speaking of support groups, you facilitate the support group, and you're over the support group Sassy Pause Sisters. It's like a tongue twister. Can you tell us more about that support group?
I facilitate, but I also co-founded Sassy Paw Sisters. So, there wasn't a support group in the area, and there wasn't a space for us. So I wanted to make a space for women to talk openly about their status. I want to empower women to their status, because the biggest fear for a woman that, this is just, I'm talking, just, I hear this from my ladies. The biggest fear is somebody coming to them and telling them, "Oh, you're HIV positive," and them not knowing what to do or to say, or "No, I'm not," or get defensive and stuff. If somebody comes up to you and say you're HIV positive, okay, yes, I am, and I want to empower them in that. And because that takes that fear of living in a closet is horrible. We didn't have a support group for women. There was one for men, there was one for trans, there was one for the LGBTQ community, but there wasn't one just for women living with HIV. And we needed a space to talk about it. Because some of these ladies don't talk about their status until we meet up. We meet up every second Thursday and fourth Thursday virtually. And then sometimes we meet on the fourth Thursday, we meet in person to have some, get something to eat, like the women we do. And then we just talk about topics about that affect us. We talk about living wills. We talk about breast exam. We talk about safety. We talk about stigma. We talk about dating, relationships, stuff like that. That regular women, those conversations are a lot different than being an HIV positive. Because being an HIV positive woman, you literally have to talk about dating. Because a lot of us are in their, still in that dating size. I have some young ladies are in their 20s, some young ladies are all the way up to their 50s and 60s. But we still want that intimacy. It's a little hard because they don't want to, when do we tell, when we disclose about our status and stuff. So instead of disclosing, they rather I'd rather be alone. I'd rather not even talk about it. So I try to empower the ladies to say, "Hey, I want to empower you in your status. There's power in that." Because you don't want anybody coming to you telling you about your status. Take that power away from them. You talk about your status openly. So that's what Sassy Paw Sister is. We talk about our status openly, and we and get information from other ladies and stuff. Do a lot of networking. We also go on retreats. We also do some things with some other organizations. That have that sisterly bond with us that nobody else that they can have with. It's amazing. And I love what I do, and I'm glad to be there for the ladies.
I absolutely love that, Shelly.
Thank you.
It's almost similar to the BroCode group. Except for BroCode group is a prevention group. It's for people that may be living with HIV or may not be living with HIV. It's for the community, the African American community, but all are welcome. But it's for the African American males that may identify as gay, bisexual, or vicarious. And it's a safe space where we can come and talk. We do fun stuff and go on retreats. So these empowerment groups and these support groups are much needed in our community, as I see it in the work that I do.
I agree.
And it's much needed. And unfortunately, there's those health disparities and the barriers that prevent people from coming to these groups. The stigma within their own self or within their family, their churches, within their own community, within their own homes. It's that stigma that prevents us from I was reading a book, and stigma will kill us.
Yes, it will.
It will absolutely kill us if we don't start embracing realities. And one of the reality is that stigma is one of those things that, puts us puts a situation or whatever you're dealing with in a bad light. And we have to combat against that.
I totally agree.
Going to my barbershop, he knows my status, but that was a thing for me, and I was like, he doesn't want to cut my hair anymore, or anything like that. And it's just being educated, being knowledgeable and stuff, because the lack of education is ignorance, and if people don't know, they don't know.
Mhm.
So that's why it's important to do your research and to get that education.
I totally agree.
How does stigma impact the lives of those people living with HIV?
It impacts them greatly. I think, like we were talking earlier, I think that's the stigma internally. I do agree with you. It's a killer, because that internal stigma, we worry about what everybody else is going to say and how they're going to react to our status and stuff, and it doesn't matter. We still have friends. I still have a huge family. I still have a boyfriend. I still have this, but I was afraid to come out of the closet or come out and say my status, because I was worried about how somebody else was going to react or how my daughters are going to be treated and stuff. That's definitely kept me being um, uh, had my status secluded because of my daughters, because I didn't want nobody. They were in school, so I was like, I didn't want nobody else to say nothing to them if they find out, because they love their mama. You met my daughters; they love their mother, so right. I didn't want that to be an interruption with them. But here, I found out as I got older, I hindered that, because I hid it. They were so worried about if I was going to die, because I didn't talk about it to them. They were so worried about my status, that I didn't even see that. And, my older daughter's 30 and 31, and she was like, Mom, I was so worried that when I found out about your HIV status that you were going to die. That's terrible for at the time she was probably like 9. That's terrible for a 9-year-old to think that. To go, if I go somewhere, go off to work, she doesn't know if I'm coming back. That's horrible. And I told her, I said, I apologize for allowing you to go through that, allowing you to have those feelings, because I should have been able to talk about my status more openly and freely about it, and I didn't. And so that's probably a regret that I do have, if about anything. But stigma, it was stigma. It was truly stigma.
And I wish when I was younger and growing up, I wish I had the education that I have today about sexual health and just taking care of myself. Most of the times I had conversations with my grandma or my mom. It's real protection. Before you go knock somebody up and have kids. But they weren't talking about, some of these diseases that were out there, like HIV, STDs, syphilis, gonorrhea, chlamydia. And and the schools also failed at that as well, because they're not normalizing these conversations, which is important, because people are sexual.
Yes, they
not everybody, but most. But most folks are sexual. Most folks have risky behaviors, and most folks are sex workers or whatever the case might be. It's just important to know, your health, take that responsibility and accountability of your health, and start learning. Get an HIV test. If you've never gotten an HIV test in the world, get one.
Get one.
They say between the ages of 13 and 50, you should
get. Go higher.
13 and 65, you should get at least one test in your life if you are not at risk. If you are at risk, you should be getting tested every 6 months to a year.
But to go back to just getting tested and having that information and having those conversations. When I'm talking to women, I say, when you guys when you're meeting some guy or you're meeting your partner, when do you guys start having to talk about sex? Oh, we don't talk. Why not?
Yeah.
Why not start having those conversations? Make those conversations normalized. I'm not saying your first date, go to a clinic, but I'm saying is ask him. When you're sitting there texting him and talking woo 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 on the phone like that, it's nothing to say, when's the last time you had an HIV test done? Those are conversations that I try to empower these women to start asking questions. Even negative or positive. If you want to be negative, if you're negative, you want to stay negative, start asking questions, because some people not everybody is open, not everybody is honest with their sexuality. They may not tell you. So there's people walking around here, not just HIV, herpes, syphilis. You're not going to tell me, excuse me, I like to know that. I like to know that, but you want to know my status, or you want me to freely tell you that. You're not freely asking me questions when we're about to get it in.
Yeah. And how would you go about like having that conversation before that? Whether you're being intimate with someone or like what's some examples that you could give us to better understand like, okay, this person just asked me what my status I told them negative. But what other steps can the person take? Because it's not always believable.
No, it's
People
not.
lie.
They do. Well, when's the like I said, instead of asking somebody what's their status, ask them when the last time they had an HIV test done. If they say a year from now, okay, well it's time for both of us to go get one. You know, let's just get it in. But that's one of the reasons why women are contracting HIV at a higher rate than normally, because they don't ask the questions. They're catching chlamydia, gonorrhea, syphilis, or whatever. They're constantly catching those type of venereal STIs, and they're not trying to protect themselves. You know, or if just believe you got treated, he didn't get treated because you felt some type of way, but telling him you're still contracting it. So soon you're leaving your body open up for HIV. You know, I can tell the ladies all the time, you can get shot for everything else. You get shot for syphilis, gonorrhea, chlamydia, a pill, whatever. But you cannot get rid of HIV. Once you have it, you have it. You can get undetectable. Which is awesome. You're right. You can get it manageable, but you will always have it because there's not a cure out there for it yet.
Yeah.
Yet.
In this case, maturity,
yes,
responsibility for people to take control of those conversations and be like, no, I either gonna save it for my husband or my wife, or I'm gonna wear protection.
Yeah. Or there's all types of protection out there.
Yeah. Or whatever, or take PrEP, or and that brings us to our next topic of ways that we can prevent some measures that we can take to prevent contracting this. And they're very simple, but some of us need that reassurance. I know sometimes I've been needing my reassurance.
I'm a PrEP a PrEP advocate. I'm a huge PrEP advocate.
What is PrEP?
PrEP is a pre-prophylactic regimen that you take prior to having sexual intercourse, unprotected sexual intercourse. It is actually I say regimen because there's so many different things out there that you can do. I say regimen because there's Descovia out there that you can take on a daily basis. There's Truvada out there that you can take on a daily basis. There's Aptitude. Am I saying that right? Aptitude that you can take.
I think you're right.
Aptitude that you can take. It's a shot that you can take every other month. That is, to me, is remarkable. But there's also, when I talk about PrEP, I also talk about healthy sex. Let's wait. How about you wait? I don't know. Let's wait 90 days before you actually have sexual intercourse. You know how much you can find out in the person in 90 days? A lot. A lot. You can. Not everybody can hide their stripes in 90 days. You got to show those stripes sooner or later. True. But also just having more conversations and talking about sexual intercourse as a conversation. I know some woman that I tested. She was married. She married this guy online. Didn't know, but for 6 months. They get together a year into their marriage. He literally says, I'm bisexual. And she's like, no, I did not know that. And he says, no, I am. And I do occasionally go and sleep with young men. Well, that wasn't part of the deal. Well, that's also didn't have a conversation before. Now, whose fault is it? Is his because he didn't mention it, or is yours because you didn't ask about it? There's conversations that we need to have, even uncomfortable conversations. You are trusting somebody with your life. And that's how I see it. You have to have some conversations, even if they're uncomfortable, and you do.
Thank you. I just thought
the mother in me. The mother in me, sorry.
Yes. And I think fear plays a lot on that, and stigma.
Oh, yeah.
The fear of stigma. They both go hand in hand. And that's the same for just a person that is negative or STD free. I know they have prevention measures, but also people that are living with HIV, they have preventive measures. What are those?
Condoms. Actually, disclosure. We have to talk about disclosure. We're talking about somebody living with HIV because there's a certain way. You don't have to tell everybody. go out and just, hey, I'm HIV positive. But if you are sexually active with somebody, you, by law, have to tell them that's your status. And I could go on about the law in so many different ways, but I see where they're coming from. But on the other hand, I think it's a hinder on people getting tested, and it also throws a lot of stigma at the HIV people living with HIV. So another measure you can do is, always wear condoms. There's female condoms out there. Inner condoms, because anybody can use those. There's lube, considered the lube queen, and our condoms, and just having more open conversations. I think
Absolutely.
talking it out and letting people know where you're at, and letting people know, but being honest about it. If you're if you're bisexual and somebody doesn't like that, then let them know that. Or you don't know, and let's say like they may be like, hey, okay, I'm good with that. See that happen too. But you have to quit taking a choice away from that person. If you say that you love that person, you care for that person so much, you have to be honest and open with them.
Thank you. Well, there you have it, everyone. Thank you, Shelley, for sharing with us and talking a little with us about the importance of getting tested and the importance of just being you and being safe and being knowledgeable and understanding HIV in our community, the Black community, because it's important.
Yes.
And it's high, disproportionately high. If you have been living with HIV, find a support group. If you're not HIV positive, still find a social group or a group of folks that are out here trying to impact and make a difference. Everybody can take a step to make this impact. Whether you're HIV, whether you're not, whether you're Black, whether you're white, whether you're old, whether you're young, everybody, it doesn't discriminate. So everyone can make an impact by advocating, volunteering for an HIV organization, talking about it more, talking about it in your homes, and just being more comfortable about having sexual health conversations. It's important and much needed. I thank you, Shelley, for being part of this conversation and letting your light shine. I hope you all enjoyed and gained better understanding of the impact of HIV and what it has on the Black community. Thank you. Until next time.
Thank you. Thank you, Melvin.